Sorry, I need to wake up. Hi, good morning. This is Mariana again, and I just, because of the emergency declaration, I want to get a little bit on school reporting because giving you the update on the data that we are sharing and that I really hope that we will be able to be sharing this data from 2 weeks in advance, but from the Pinal County point of view. So for now, let's go about the school reporting. So this was sent yesterday, and actually I just grabbed here. I bet that you have the whole thing, but the most important part is this one that says ADHS enhanced COVID-19 reporting for schools, childcare, and shelters. So it's not only the schools, also the shelters, and it's very important because in shelters, it's all about congregating settings, and we talk about how important it is when you have people together, the virus can jump from one to the other. And now this has been a little bit confusing for the health department, and I actually have been talking with my counterparts in other counties, and it says supposedly only to report outbreaks of COVID-19 to their local health department. But actually what we think is that you are not the ones responsible for letting us know the outbreaks, and we will never know about an outbreak if you don't begin reporting cases, because we really need to know about everyone that somebody will come with a paper from the doctor saying, well, the kid has been diagnosed with this, with COVID, or sometimes what we will see is that you or the nurses will detect somebody that was sick at school, send them home to quarantine and be tested, and then they come back with the diagnosis. So we need both things, and especially because the outbreak, the only way to detect an outbreak will be to begin connecting the dots when we investigate each one of these cases. So it's very, very important, please, to report everything, cases and outbreaks. So everybody should be familiar with this, is the report of communicable diseases to the local health department that the schools needs to do. It is supposed to be an administration of a school, a child care establishment or shelter to us. And I bet that you have seen it, you have it. When we did our nurse conference last year, we gave them some to have in the office. So basically, COVID has been added to this list in the 24 hours report, mandatory report. And it's not there yet because ADHS has been taking time and update their website, but it's going to be there at some point. So take it as these things. Take it as any of these communicable disease that you have 24 hours to report. Just add COVID to your hard drive because it's going to stay there for hopefully not too long, but for more than a little. So there are 3 ways to communicate with us. You can email, you can call, or you can fax. At this moment, in the email, we have a shared email that is the ites@pinal.gov. Actually, and we have every EPI has an email on their own. I'm asking please to, if you send to ITES, also copy me or one of the EPIs. And if it is all, everybody will be okay. Somebody will come to this when it's case, but this is only please to report cases or questions about reporting. Then you can call. At this moment, the best way to find us is in the ICC call, and our phone liaison is 520-866-4513. My cell phone is there, the 520-705-8828. And also the on-call, the 24/7 on-call for the county is the 520-866-6239. I need to say now that please remember to, this is not an emergency to call us at midnight. You can, even the on-call number is 24/7. We need to sleep too. So if it is not a real emergency, please use the on-call, but call in between business hours, and that one you could be like 6 or 7 when you finish your activities. It's fine. At this moment, it's going to be Corey or me who's going to answer that. Yes, I see that in my email. In the email, I have a mistake in Daniel's email, so I'm going to correct it, and then we will send this information. And on fax, the ICE fax is 520-866-2929. And all you have 3 ways to send it, and I develop a form. Well, before that, what we need from each case is the demographics, name, age, date of birth, address, race, and ethnicity. And then in the symptoms, we need what we were going to get is the date of onset, the list of symptoms, the last day of school, the hospitalization time. That's what we ask. It's not going to be that much for you to ask, but we will ask you to put in our form the date of onset at least, please, and if the kid was at school with symptoms or not. And then in the test, we really need to know the date of the sample and the results, the location and the type of test that if you have it. If you don't have it, you just said test not available. But this is the most important thing for us. So I have been working on this new form, and to report the COVID, and it has the required student information. We really need the name, the date of birth, the address, the city, and especially if the student is a Pinal County resident. Then I'll have some required school information, and I'm gonna ask also if the school is in Pinal County or not, because there are some overlap with the schools districts and some zip codes that are half Maricopa. Some school district has half Maricopa and half Pinal. So if you're reporting to us, we really need to know, because actually the reporting needs to go to the place where the student lives, the residency, the place of residency. And that's why it's so important for us to know if the student is a Pinal County resident or not, because the school, if the school is in our zip code, the school also needs to report to us. So maybe some of you are going to do double reporting. I'm really sorry. And trying to avoid this, we can share with Maricopa if it is necessary. So I think that's about the school reporting. And are going to, if you have any question about reporting, I'm hopefully having that information and the form complete to email soon, or maybe with the link of this presentation, maybe tomorrow, because I still need to work on some things that I need to put there. And okay, so now about the county situation. I showed you this last week, and I want you to see how things have changed, so you are not in super stressed about how the benchmark have changed. And so if you know what is happening in the whole country. So the first thing is that if you look at here, we have, we have this. We were like really nice going down, and then we have this. So 2 things happened at the end of week 33. I know that I shared with everybody that ADOC decided to test everybody in their places of residency. In their correctional facilities. So we began receiving information about some correctionals, and not everybody actually tested positive, what is really important to know. And but also we saw a lot of people from specific places on the community in Pinal County that are community members, that were families tied, like it was obvious by the address and by the names. And then when we began investigating the cases, they were like, yeah, I'm the father, and my wife and my 2 kids also tested. So please don't think that this is only correctionals, because it's not. Then our epi curve, if you see here, that's what we're seeing here. We're like really nice going down, and then this one came up in week 34. So this is coincidental with the first week of opening school, some schools. After this is the week of the August 17th, and that community spread that we're seeing is actually all some around those places where some schools open. So we need to be very aware of what we're seeing. Then the death for now, up to week 34, we have 176 deaths and counting, sadly but true. Now, one important thing that we did for all of you to be a little bit more at ease with the information from community versus correctional facilities. So our data analyst was able to separate the presentation of the cases in the community that are there in blue with the presentation of the cases in red, that in correctionals that are there in red. Now, the people that works in correctional facilities are not listed in the correctional information here. These are only inmates, because the people that works in the correctional facilities are part of our community and actually bring the disease back and forth from the correctional facility. Now, the first thing that we discover is that only 10% of county cases are actually inmates or detainees, and they are located in only 2 zip codes. We are going to work with those zip codes to get an estimate of the cases in the community to give you the color. So we have this information per week. Now, if you look at this curve, you will see that it's very similar to this one, that one, and that one, the yellow one. See, if you look at the yellow one here, how it goes up in week 22 and peak in week 28 and go down to week 33, you will see that it's very similar to this one that goes up in week 21, 22, peak in week 27, 28, and go down in 33. What I want to show here is that when you compare the population, the graph comes from a different date, and that's a thing in the data, so we are able to do this analysis. But at the end, even if the peak is not at the same exact time, you can see that the shape is kind of the same. So actually, this demonstrates with data that the correctional facilities numbers are really not skewing too much the data on the whole county. So even if we don't do this and ADHS is not doing it, you can have a good idea of how the county is behaving, even with considering the correctional facilities information on inmates and detainees. And it's because if you add the correctional officers that are part of the community, the amount of people related with correctional facilities in outbreak will increase. So that's at least for you to know that we are working on this, because I always said, please trust us that we will try. So we did it, and that's what that's the result. So let's review the benchmarks for this week. ADHS, this is from the dashboard. They have us in less than 100 cases per 100,000. And if you see, the difference is only one. The number between one week and the other one is 447, 448 is nothing. The rate at the end stays the same, and at least we have less than 100 cases per 100,000. Now, before we had the decline in cases and not the A and not the B. Now we have the B and not the A. So at some point, hopefully we're going to have this too. Now, we saw an increase in cases. You saw how the graph went up. So we could expect, depending on what happened on the rest of this week, that the next time that this is updated could go back to yellow. So just to know. Now, we have not been able to go to the 7% benchmark, not yet. In July 26 was 10.6. In August 2nd was 8.8. What we have seen is that we are slowly going down on the percentage of positivity, and it looks like we were in the right way, and we could stay in the right way because the amount of cases, the increase of cases has been also an increase in reporting. So the proportion should stay a little bit stable, and maybe we keep going down on this one. Under 7% is going to get us, we are still in yellow. So at least the 8.8% between the 10 and the 5 is yellow. So at least we are kind of okay on that one. And then the 2 consecutive weeks with hospital visits for COVID-like illness in the region below 10%, that has been stable from the last time. Actually, they're showing 2.4% for week 33, so it's super good. Let's see if that continues in that way. It should. It should before we hit the flu season. So now this is what it was published, and this is Daniel's work, and he is getting all what we have said in consideration when he assigned you every school or school district a color. So we have seen that some of the cases, some of the school districts have been going from red to yellow. Some went to from yellow to red. And also Daniel added the high school districts, and they're both still in red. But we are considering everything, just for you to know. So that will be as a presentation. And
I've got a couple questions here about the reporting. So we might need to circle back to that. So they're asking if the report form, if there's a form that's been made and approved to give to parents when they go home when students go home with symptoms.
Like a letter? Not yet, but we're going to modify one of the letters that we have, so you can have this as a kit. We're going to have one form to report for the students, one form to report from the staff, one form to report outbreaks that will, for the nurses, you know that the one for varicella, that's kind of the idea to have for us, so it's easier. Well, I also want to have a template on an Excel that will be easier in some case. And that letter, the exposed letter that could be sent, and some information about coronavirus.
And then the other question was that the report form just includes how we can report adults in the school that might come up positive as well as students.
Well, that's why it's one for students and one for staff.
Okay.
Because staff could live outside the school district.
Well, students could as well, especially in charters. So maybe just a consideration. Is there a formula to determine the 100 cases per 100,000? What is the formula to determine? Sorry.
So what you do when you detect any rate is to get the number of cases and you divide by the population that has been exposed to the issue. In this case is everybody. But for example, the best example is the pregnancy rate of a community. You will not include the males. That's why it's the population exposed. So you will only have the number of pregnancies divided by the women in the community that are in fertile age. So in this case, we use the total population because everybody is exposed. We do not know the exact where the ADHS got the number for the denominator, and I asked for it, and we don't have it.
Wanting to know when the form will be coming out, when the reporting form will be available.
Hopefully today, hopefully today or tomorrow. I need to finish and check with everybody here if there is anything that I forgot. So it's gonna look like that, and I hope to have it soon.
This question says, you indicated the increase in the number of cases coincides with the opening of schools. Does the data indicate the increase is coming from a specific zip code or from across the county?
What we have been seeing is that we saw more in the northern part of the county, but also we need to include there the increase in reporting from correctional facilities. But what I wanted to say is that we're very on it, trying to see if it is because of the schools or because of other things. So far, we think that it could be a relationship, but as anything with data, we need to wait a little bit to know.
Thank you. That's all the ones I have here.
Okay. So the ones that have been submitted, I'm going to try, but it's kind of a lot of things that we do not know. So are you able to identify any successful models of reopening that we can follow with no cases of spread? Actually, there is no information that will say a specific model. The last MMWR from MMWR, the morbidity and mortality weekly report from CDC, presented an article about a childcare center with limited spread in Rhode Island. So a lot of people were like happy to see it, but then when you are reading and being in discussion, there are a lot of limitations on that study. One, the population was small. Second, the kids were almost everybody, didn't have other siblings. And the third thing is, and the most important, was that the community spread at that moment was low. So anyways, the only thing that they discovered was that there was more transmission when somebody went forgot the social distancing, the mask, and the washing their hands. So deviation from the indication of cleaning and everything has been related with spread inside educational location. Nothing else to say. What are our best options to protect immunocompromised students, faculty, and faculty families, high-risk staff? Until we have a vaccine, the best option is that they are not exposed. And that's critical when you have immunocompromised students. That is going to be more difficult for them to follow up in the mask, in doing things. They will need, it will be ideal that you will be able to keep offering a hybrid to protect a hybrid model of education to protect those kind of kids that needs to stay at home, even if you're in green. And faculty and faculty families, same thing. How to do it, I don't have that answer. But the answer is that if somebody's really immunocompromised, should try to not expose themselves. Our school has a large number of grandparents caring for students. How do we best keep them safe? So there is one thing. The student maybe it's responsible for the 50% of the risk. The other risk is the risk that the grandparents actually take every day to go to the supermarket, or any of us go to the supermarket and things like that. On your side, maybe the best way to keep anybody safe now is education, that use the mask, wash your hands. The kids can, you can make all the kids use hand sanitizer when they leave, for example, the school, and reinforce that they need to arrive home and wash their hands before hanging the grandparents, but it's just the same thing. Next one, students are identifying students as super spreaders with higher viral loads. At what age does this decrease and how much does it decrease? I cannot refer to studies that I have not seen. I have heard about this, but I have seen also some others that said that it's not true. So if you want us to comment in some specific studies, please send us the information ahead of time so we have time to read it and let you know if it is a good study or not, and compare it with what the CDC's guidance are. Studies are showing Arizona is having one of the highest mortality rates for children per capita. I'm not aware of that really. Also, I don't know which study will be. Are pre-teen gatherings safer than young adult gatherings, which has been identified as major spreading events? No gathering is safe. So yeah, just no gathering. What are Arizona's numbers so much lower than those identified by Johns Hopkins University? I haven't seen what Johns Hopkins University has, but what I see specifically by state, but Johns Hopkins has a cumulative dashboard. So it's from the first case to today, everything that has been reported. So maybe that's the difference. You need to see if you go to the, not the dashboard for the school, but if you go to the normal dashboard, you will see the cumulative information. And then in the dashboard, you are seeing the recent cases per week. And maybe that's the difference. I'm not sure it's that, but that's the only idea that I can. What lessons can we learn from schools that have opened between 7 to 10%? I think that in 1 week, we do not really have any good lesson to share. We have seen in Florida and Georgia that they open and then they need to close again. But we don't know if it was because of really super spread or because they didn't follow the instructions. So nothing published yet, nothing that is solid for us to share with you. We will not share anything that we heard in the grapevine. How can we most effectively manage transportation with minimal air circulation and large numbers of people? That's a really good question. Lately, the only thing that we have here is driving the windows open, especially because the air conditioning will kind of share equally. If one person has a virus and is sharing, it's gonna kind of share equally. Now, COVID is not an airborne disease. So it's not like measles that you have one measles case in a bus and you're gonna have the whole bus as a contact. COVID is droplets. So using the mask when you're riding the school, especially the school bus, and keeping your hands to yourself. Also, wash your hands before going into the bus, and then cleaning the bus is more important than actually the air circulation. But if you can be in a little bit safer, you can open the windows. Something that here is a little bit funny because it's hotter outside than inside as well. You're moving. What effect did spring closures have on child infections rates? So that's a very good question too. The child infection rates went really decreased when in the spring they said, okay, we close the schools and we finish the school year as virtual. It was really important on the rate of infection for children. So, but we cannot stay at home all the time, especially the kids that need their instruction. But yes, it worked. It helped. And especially in that time when not everybody was using masks. And that's also why we have had time to present a plan and a proposal on how to come back to work, have time to spread out, convince people that use masks, have hand sanitizer everywhere, etc. Do you recommend that we include a statement paragraph in our mitigation plan regarding the outbreak logistics so that parents understand how long our school may need to be closed to in-person classes until the typical quarantine time is over, plus waiting 2 additional quarantine blocks? I would say that there is a possibility. I'm not sure that you need to give a specific time, because if for any reason transmission continues and continues and we go over that specific time, then parents can tell you, well, you said this and you wrote that. So you never know how long the outbreak could last. So I will say until the health department says otherwise or something like that. You have more.
This is Corey. Yeah, exactly what Mariana said. If you try to put an exact timeline, people are going to try to own that and stick with that, and that's going to create a false sense of security. There's so many, when we've dealt with measles outbreaks and other communicable disease outbreaks, you know, we always do the 2 incubation periods to call off that outbreak. But there's other circumstances that may arise where it's not safe. So we'd hate to put any stipulation in there that people would want to go by regardless. You could define, you know, 2 incubation periods. You could define what a quarantine time frame is. You could say those things, but don't make all the criteria, don't spell out all the criteria of reopening again. Just define what these periods of times are.
Yeah, especially because in COVID, we still haven't had any outbreaks. We have had outbreaks in correctional facilities, but we haven't had outbreaks in schools really that we need to manage. So the possibility is that, yes, you need to close or not, or some kids, we need to send one class to quarantine, so only that class will have hybrid. So we will discuss and give you the best thing. If you write that we will take two incubation periods without cases to reopen, you need to add from the last case identified, because that's very important. They say, oh, but we went through 2 of the first case, yeah, but now we have 50 more cases. So you need to get it from the last one. We don't know how this is gonna spread.
So meanwhile, we've received a few more questions. I wonder if you could navigate to the Pinal County website so that we could show them where they could find the exact same data you just showed on the website, because that's the question. Is the school district table information available online? And do you recommend schools open by this table or use the countywide data?
This one, I'm down there or not?
Oh,
Yeah, that'll work.
this will work, okay. So we're going to go to the coronavirus, and then we're going to go to public health information, and then you'll scroll down, you'll see our current case counts for today that have just been refreshed, and then you'll go scroll down, and there's your school benchmark information.
And what is the definition of each one?
Mm-hmm. Yep, the definitions, and then you'll go through the school district data.
Thank you. So the question was, do you recommend schools open by this table, meaning more district-wide data, or by county-wide data? And I think that might depend upon the school district.
Yeah, I think that you are not required to follow this table. We're giving this information because some people thought that it will be more helpful, but some other people think that it's not going to be so helpful because of, especially the correctional facilities, the ones that have some zip code that has enough correctional facilities. So we will ask you to choose one and actually stick with that one. So if you want to follow the ADHS that is for the whole county, and just use ours as a different reference. That's fine with us. But if you ask for a waiver, you will need to tell us which one you're following.
Thank you. The next question is, has there been a flow chart made that helps schools follow protocol when they have a reported case or exposure within a class or cohort? So I think the reporting is what they need to do,
Yeah.
right? There's really no flow chart per se, other than you just need to report immediately.
I think that's the first thing. That's the most important thing, and then we'll work together from there.
We have two questions about outbreak. So, how's an outbreak determined? Can you go over what an outbreak consists of? I think we may have a misunderstanding of what constitutes a close contact and what epidemiologically linked is.
Yeah. So the definition of outbreak, it was given in that news release that I put at the beginning. And if you read there, it says schools are encouraged to report an outbreak, and an outbreak is defined as 2 or more laboratory confirmed cases of COVID-19 within a 14-day period among individuals who are epidemiologically linked, do not share households, and are not close contact of each other in another setting. So I think I gave the information on if you have 2 siblings, for example, that's not an outbreak because they share the household. So if you have a teacher that have their 2 kids in the school, we count the 3 of them as kind of one case in outbreak speaking, because they will be exposing other people, but they live together. Now, if in one class of those kids shows up another case, and they are like best friends, and they sit in different space of the classroom, we will go and do the investigation. And then, you know what happened? We discovered that the second student, it's actually the neighbor, and they play together in the afternoon, or they do the homework together. The transmission was not actually done at the school. The transmission was at home. So even though you have 4 cases, you still don't have an outbreak. Now, then after that, if we find that on those 2 classmates, one friend that sits with them or sits in the next row got sick, and that person doesn't have any other contact, nobody in the house, he doesn't go anywhere, goes home, school, home, and the only way that he could get the disease was through his classmates, now you have 2 cases, even though we actually counted 6 before or 5 before. That's the moment that we declare the outbreak. For some reason, there was transmission inside the school. Also, for example, in the teacher, we found another teacher, and they shared the break room. They were eating together. One of the worst thing in our jobs is the break rooms, because we need to eat. We sit there to eat, and to eat we need to take away our masks. And we have this bad habit of socialize a little bit. So we talk and we discuss things when we're eating. That's when the 6 feet are the most important part, and not eating everybody at the same time. Here, for example, at the health department, we took away some chairs, so we don't have in the tables where we used to have 6 people seated. Now we have 2, one in one corner, one per corner. So those are the things that you need to think about.
Mr. Dwyer has offered to provide a model that another state has used. Jill was saying that she heard on the news that Hong Kong had their first case of COVID reinfection, and then Janine McCorkle sent us a link to an article about that, so I'll forward that to you guys so we can kind of check that out. Here's the next question. Should we be using this sheet, I'm assuming you're talking about the reporting form, for children that have symptoms to determine how long they should be staying home. The ADHS release from isolation and quarantine guidance. Okay, so they're asking if we should be using the ADHS release from isolation and guidance to determine how long a student should be staying home. A student with symptoms should be staying home.
So the release from isolation is what we use to release from isolation, at least this county. I think it's the only one that we're calling everybody to check that they did the 10 days and to let them know when they can actually go back to their normal life, including work and school. Because of the peak that we have in June and July, we skip a lot of those cases. We're calling now, and yes, it's true that we call and they're already working back, but we kind of try to check. But now we're beginning a new time in this pandemic, and hopefully we will call when we do the interview. We will let them know when they can go back to school and what to know if they need to go to a doctor or do other stuff. So basically, yes, we use that, but we will be supporting and telling everybody when we do the investigation what they should do. And also, we provide, if the parents requested by email to ICE, we provide letters for people that has been released from isolation and quarantine.
Okay, so I have a couple of concerns from Greg Wyman, and you're welcome to unmute yourself, Greg, if you like, because we know that you're in an unusual situation. He is from J.L. Combs. He says, I have...
I'm here, Jan, if you want me to just explain it.
Yeah, absolutely. And this may be something that we need to have you and Daniel touch base on offline, but I thought I'd just kind of bring it up.
Well, it comes to, there's just too much confusion out there. I'm looking at the slide. I'll kind of marry the two together, but I'm looking at the slide, and this is taken off of ADHS's website or their PowerPoint that says a moderate percent positivity is 5 to 10%. Yet earlier in this presentation, as well as if you go to the next slide in the ADHS presentation, it says in order for you to be in the moderate range and to get a green, you actually have to be below 7%. So I know for a fact on my moderate range, I'm at 9.7. So I am not in moderate, according to ADHS. So now I'm going to get ADHS's pictures, the Pinal County pictures, and now we're going to get zip code pictures. You may have an issue where zip code is related to the increase in COVID cases, and it's related to schools that are open. I don't think there's a ton of schools open in Pinal County, and I can kind of tell you what one of the schools is, and it happens to be my zip code. But I'm going to get absolutely hammered Thursday night by parents who are going to see I'm in yellow, and they're going to ask me why I'm not opening up my schools ASAP. We need to get on the same page. This misinformation, this confusion, and I apologize, I'm getting upset, but I've been getting hammered for 2 weeks. And this is going to go ahead and extend it for another 2, 3, 4 weeks. Now, it may not happen in the rest of the county, but I joked last week, my flak jacket is just about beat up. And it's on back order, and I'm not going to get another one for about 3 weeks or 6 weeks. And so somehow we cannot have all of this disinformation, misinformation, and confusion constantly out there because our parents are selectively picking the information they want for the answer they want, and then they're throwing it in our faces at board meetings. And so I don't know what to do, but I'm irritated to beyond belief that I have to go through this meeting. I've called people for 3 days trying to figure out what the heck means I'm supposed to start school and not start school, and I can't get a legitimate answer because everybody tells me something different. It's not fair to school boards. It's not fair to superintendents.
Greg, I understand how you're feeling, and I think that from what I'm seeing, it kind of lies in the fact that ADHS had put out the benchmarks on one location, and those are the ones that are on your screen in front of you. And then in the guide to reopening schools, that's where they reference the 7%. Which is different. And so ADHS had put out these two kind of similar and complementary metrics, but they're not the exact same metrics. So if you're telling us that for your purposes, it's better to report from the 7% from the guide to reopening schools, then maybe that's information we needed to know.
Well, we just wrote it down to share it with ADHS, and I can tell you that we were in the same boat at the beginning of this pandemic with what we were supposed to do with each case, because it has been, I agree that there is, I will not say misinformation, I will say too much information, and it's only because people has been asking for it. We, from the beginning, didn't want to go through the zip code because we know that is not very accurate. It's better to go through the county and consult with us if there is any cluster or anything. But at the moment that ADHS decided to pass the responsibility to the counties, and some school districts wanted to have the zip code information, we need to provide it for everybody. So we understand.
And I understand where you guys are coming from, but I've had a few conversations. So let's get this so that where red means green, green means red, red means yellow, green means yellow. And I'm being facetious, but what I've been told is that if you hit below 10 for positivity, you're yellow, but it really doesn't count, and you can't go to hybrid until you get below 7. However, so if I was 8 or 9 for 2 weeks, I could not be in hybrid because I'm not below 7. However, I've been told that if I'm below 7, I'm at 6 for a couple weeks, and then I bump up to 8. Guess what? I can stay in hybrid. If I go to 9, I can stay in hybrid. It's not until I go to 10 that I go into red that I can no longer be in hybrid. So if I'm going up the scale, it's okay for me to be above 7 to stay in a hybrid model. If I'm going down the scale, it's not okay for me to be above 7 to be in a hybrid scale. This is the kind of confusion that people are being told around the state, and this is what's leading to the problems. I understand politically why that's happening, and I'm not going to make that comment, but we understand why it's okay to be going upwards trend and still go ahead and keep your schools open, but on a downward trend you can't. This is, we somehow, whether it's ADHS or whoever, we have to get on the same page, because this is crazy that we can't even get on the same page for what it is. Is it 10? Is it 7? Is it 5? Is it 6? Is it 8? We don't even know. That's just nuts. And it's not your guys' fault, so I apologize if I'm coming on against you guys. That's not my intention. But the frustration is that between the governor's office, ADHS, no one seems to know what the real number is of when we start. And then, quite frankly, we don't even have to follow it anyway, because we can do whatever we want because they're just guides. I mean, it's just nuts.
And I agree, but the only thing that I would like to add is that what you're seeing in the screen is what we go through, and the benchmarks are 3. So if you have 1 red, it's going to keep going big red. So that's the guidance that we go through to assign the colors on per school district. And yeah, we hear your pain. We have been in that boat.
So I know you guys meet with ADHS on a weekly basis. I know that you'll bring this to them. So hopefully we'll have some answers for you. It's not always easy to get answers out of a big agency like ADHS, but we'll certainly advocate on your behalf.
And don't worry, we are always the problem, because they don't even want to hear that I have a question.
We're the problem children.
We're the problem children.
He's bringing these things up.
We will keep being the problem children. Don't worry. We will ask.
That's all the questions I have in the chat box. So do you have anything else you wanted to add, or do you want me to ask for an open call for questions?
No, unless somebody else have more.
If we're missing any other questions.
Jen, it's Peter Dwyer from Red Rock. I threw a question in there. You know, the information from the county has been great, and we really appreciate it. Well, why is ADHS so elusive to us? Can we meet with them? I mean, I had heard what you guys had just said, but I mean, Greg's questions would be really helpful to have Greg's speech to ADHS. I mean, we've spoken to everybody. Why is ADHS so elusive, and why aren't they speaking to the superintendents?
That's a really great question. I'm not sure we know the answer to that one.
But
it's a question we can ask them.
I think that it could be a matter of having enough people to do something, or they're doing it to their equivalent and then expecting the information to go down. We really can only speculate. But it's happened with us too. If it's worth to say.
Yeah. We can certainly put in the ask. Anything else for the greater good? If not, I can give you 7 minutes of your life back. There we go. Please do me a favor and keep emailing me your questions, and I will put us on the schedule for next Tuesday at the same time. And in the meantime, I will send out the recording of today, and of course the copy of the emergency measure requiring schools to do the reporting piece. Thank you so much. It was great talking with you, and I'm glad to hear from you and get some feedback. Thank you.